Why do Black women face far higher risks when it comes to medical attention, and how faith, community, and policy can work together for change? We're going to get into it. Let's get it. Welcome. First of all, welcome. This is Unsolicited Perspectives. I'm your host, Bruce Anthony, here to lead the conversation in important events and topics that are shaping today's society. Join the conversation and follow us wherever you get your audio podcast. Subscribe to our YouTube channel for our video podcast, YouTube exclusive content, and our YouTube membership. Rate, review, like, comment, share. Share with your friends, share with your family, hell, even share with your enemies. On today's episode, I'm joined by Dr. Wylin Wilson, author of Womanist Bioethics. We'll be talking about Black maternal health crisis, why Black women face higher risk, and how faith and policy can drive change. But that's enough of the intro. Let's get to the show. My guest today is Dr. Wylin Wilson, Associate Professor of Theological Ethics at Duke Divinity School, where she teaches in Theology, Medicine, and Culture Initiative. She's the author of Economic Ethics in the Black Church, and her latest book, Womanist Bioethics, Social Justice, Spirituality, and a Black Woman's Health. Dr. Wilson's work focuses on intersection of bioethics, gender, theology, and racial justice, with particular attention to the Black maternal health crisis in the U.S. She's also leading a research project on the role of the Black church in addressing racial inequalities in health. I'm honored to have her on the show today. That's enough of me talking. Let's get to the interview. So as I said at the top, I'm here with Dr. Wilson. Dr. Wilson, I want to thank you for joining me and my audience. This conversation that we're about to have, I feel, is very important. And it's my pleasure to have you on the show today.
Thank you. It's wonderful to be here.
Okay, so I always start these interviews off with a question of how it all began. So you've built a career at an intersection of bioethics, theology, and gender. Can you share a little bit about your journey from your childhood to your academic career to getting to this point? How did you get to this very unique path?
No, thank you. Yeah, so my journey, I'll say it began with just a whole bunch of love. My family is, some of the most loving people you'll ever meet. Wild folk, loud folk, but loving folk who taught me the significance of loving and caring for other folk in our community, who taught me how to, not put myself first in the sense of, I'm so, how we see a lot these days, unfortunately, people who, I'm so self-important, like it's all about me, but thank God I was in a family of people who believed in serving others and who believed in putting others first, not to the detriment of themselves, not that kind of dangerous self-sacrificial kind of love, but just a true love and care for community and for and just this embrace of the gift that life is to us, right? It is just such a gift to be a part of the human family and to be sustained by the earth, right? That's another gift. The sustenance that the earth gives us, the nourishment through food, just all that we receive as a gift in this life. And so to honor that and to give back to others. Yeah. That's how it started with my family. That's how it started.
So it starts with your family, but eventually you progress through middle school, high school, and you get to college.
Yes.
Was there a moment that you said, aha, this is the direction I want my life to go in?
Yeah, I will say even before, I'll say even before college, I grew up hearing, because I'm a child, I'm a child that was born just 10 years after the desegregation of hospitals, right?
Mm.
Of public hospitals. And we talk about, desegregation of school
Hmm.
systems and restaurants and, other public facilities, but we don't talk about just how much damage has done, how much death occurred in Black communities and even among poor whites during segregation, because these minoritized individuals were not served by, the medical system. And so I grew up hearing these stories, horror stories of Black folks who went to medical facilities for care, but where care was lacking because of that intersection, right, of race and health.
Mm.
And so hearing those stories about how our medical system failed Black folk, failed poor folk, right? That really, really helped me to develop this understanding that, these institutions that we build as a society can do so much damage when we don't have people prioritized, or when we have only some folk prioritized, right?
Hmm.
And so that I think was really important, and that really helped to form me and form my understanding about, how we should be thinking about how institutions work. And so by the time I got to college,
Mm.
I majored in agriculture. I am truly a daughter of the soil, if you will.
Okay.
If I could literally, I kid you not, just go and have myself a little farm somewhere, I would do
Hmm.
that, But in the meantime, I've just tried my hand at gardening and whatnot. But I truly love agriculture, and I majored in agricultural business at the Florida Agricultural and Mechanical University. And
Okay.
so I am a rattler. Orange and green blood flows through these veins. I'm telling you right now, they gave me my foundation, and I love FAMU for that. But yeah, so majoring in agriculture, and then going on and majoring in agricultural economics,
Mm.
right? So I come out of college with this clear understanding that the solution to problems is this kind of economic solution, because and we hear that a lot, right? Well, if there's a problem, if for poverty, people need more money, they need jobs and all that. Yes, I'm not saying that's not true, but one of the things I learned on the ground in communities, and particularly when I was working at the Bioethics Center in Tuskegee, I got a chance to really learn that yes, we need to be concerned with economics, but my goodness, if people are sick, they cannot work,
Right.
right?
Hmm.
If we're not taking care of the health of individuals, then they are at such a great disadvantage when it comes to even trying to take advantage of opportunities
Mm.
that they are in the community. So I really got this beautiful understanding of just seeing how everything works together. And that's how I got to bioethics, right? Because, here I am. I was always, even through my graduate program, I was looking at community economic development, the importance of that, right? And the
Hmm.
role of the church in that. So I was really sold on that. And I still think it's super important. I'm still very much someone who advocates for that. But we have to, at the same time, attend to the health disparities that exist in our communities and in minoritized communities broadly in this nation.
So you brought up something interesting at the top, and my audience knows I'm a historian, right? Degree
Uh-huh.
in history from
Yeah.
the University of Maryland. Go Terps! But
Oh.
but as I've gotten older, I'm learning, even with my history knowledge, my American history knowledge, and even the knowledge that I know about the civil rights. You just informed me that hospitals were segregated. Now, I figured that we Black people were always getting poor care. I didn't know that the hospitals were actually segregated, which I guess would make sense. If you segregating restaurants, bathrooms, water fountains, why would you not segregate hospitals? So when did hospitals during the civil rights movement become desegregated?
Right, right, right. So thankfully, hospitals became desegregated close to like 1964, right?
Okay.
There was a very important court case, a Supreme Court case, Simpkins versus Moses H. Cone Memorial Hospital. It was really instrumental in the desegregation of hospitals. And it was some doctors, some Black doctors here actually in this state of North Carolina. But yeah, Dr. George Simpkins, his patient was denied admission actually into a hospital. And so he filed a lawsuit
Mm,
because, the hospital was receiving state and federal funds via the Hill-Burton Act in 1946, right? But anyway, but the point is that this just denying people care because of the color of their skin it was prevalent. I mean, I remember when my father grew up during segregation,
mhm,
and when my mom would take me to the hospital, he said there was a white waiting room and there's a black waiting room. And the white waiting room, there was carpet on the floors, nice cushy chairs, and it was just beautiful. Walls were painted. He said in the black waiting room was kind of like back in the back where you had to go around. The floor was unfinished. It was like dirt and
mm.
concrete, right? Lawn chairs thrown in there, no paint on the walls. He said, and so it was very interesting because, here you are in a place to get care. And as soon as you walk in, everything is screaming, we we don't care about you, right?
Screaming
Yeah,
prison. What you're describing
yeah,
sounds like prison. Yeah.
yes, yes. And even and so it's interesting. I even wrote in the book about how in one place in particular, there was not a hospital that even served African Americans. And so they actually would put them into prison if they were sick, right? Because that was a place that they had available. So it's just, I mean, so
Mm.
it's just wild when you look at the history of you know the medicine. It is really insane to see what Black folks have suffered, what minoritized individuals have suffered. And so yeah, so because at first when there were no Black hospitals, and then Blacks weren't being really served within mainstream hospitals, that meant that Black folk who were trying to be doctors didn't have a place for their training.
Mm.
Right. And so that meant then, so we needed Black hospitals
Mm.
and Black nursing schools, because of course, Black women at the time, what was majority, women, right, were not allowed in white nursing schools. So it was really beautiful. I love that history of Black hospitals and Black churches because and a lot of Black women, from Black churches and the Black Club Women's Movement, a lot of those women were raising money, right?
Mhm.
Scraping those pennies, dimes, nickels, scraping all that money together to help establish Black hospitals, Black nursing schools. It's just a beautiful history of how our institutions within the Black community have a powerful legacy of care.
Mm.
And particularly the Black church. And I also, wrote about that in the book of how that the Black church has a legacy of care. And in these times that we are in right now, I think now more than ever, we really need to lean into that legacy of care,
Mm.
right? Because we really have to pick up where the shortfall is, with a lot of the policy changes that have been made under this administration. I mean, it's just so much, a lot of the rollbacks, even with environmental protections. A lot of
Mm-hmm.
minoritized communities are going to be very much affected by a lot of the rollbacks in environmental protective policies. So it's time, that means then our institutions need to really and truly lean into that legacy of care, because
Mm-hmm.
we have to do it for ourselves. We really do.
Yeah. And for the audience out there, I just want to put something in perspective for you. So you said the desegregation of hospitals was in 1964. That was 61 years ago. For some people, that's one generation.
Mhm.
Listening, it's one generation. For some people, that's two generations. For me, that was my mom and dad's generation. For some people listening, it was your grandparents' generation. That's not that long ago. That's so when people say, "Oh, that was so long ago," it's not that long ago. It really
Nope.
is not that long ago. You bring something up, and you were talking about Black people as a whole, but I want to get gender specific here. So, Black women in America face mortality rates more than twice the number of white women. From your perspective, what are the biggest factors driving this crisis?
Yes. So there are several. One of the biggest factors is the actual, I call it the normalization of Black suffering,
Mm,
right?
okay.
And that began, I mean, that began in with the birth, with the literal birth of this nation, right? With enslavement. Um, the suffering of Black people has been normalized, and we've not come out of that. We've in fact in fact we literally continue to live in that and live into to that, because the fact that health disparities are what they are in this country, that Black women are actually, half of Black women have 20 years and older have hypertension, right? Heart disease is the leading cause of death. Black women are more likely than white women to be diagnosed with diabetes. They're understudied in healthcare, and you already mentioned the maternal mortality statistic, and we haven't even scraped the surface of getting to maternal mental health
Mm,
issues, right? So,
hmm.
so all of this compounded, right? And now these disparities, they they didn't just pop up a few years ago, right?
Right.
Like our health disparities in this nation have been consistent, right? So the reality is that we are so desensitized to Black suffering. And that's the first step. That is to me the first thing that I think we really have to deal with, because one of the things that I know, and I even notice, listening to people in your community where folks talk about um you know our health disparities that Black folk experience. And it's almost, like people kind of shrug their shoulders like, well, yeah, that's the way things are. No, we should literally be outraged at the statistics of the health disparities that exist, right? This should be something that is urgent for us, right? We should feel a sense of urgency, because it should be, no, people shouldn't be suffering like this. No one, Black, brown, I mean, immigrant, nobody should be suffering like this. And so I think, that is one factor, right? Um, but then another factor is that a lot of times we have, these disparities that exist, these health disparities that exist, they cannot, of course, be attributed to just our behavioral differences, right? Or biology. We know that we can't attribute just, to that. But really and truly, there's been consistently a pervasive devaluation of minoritized bodies. And
Mm,
until we come to terms with that, right? Until we come to terms with that, I think we will still find ourselves struggling with health disparities, right? In years to come.
How?
But also, go ahead. Yes. Mhm.
No, how? Okay, so that seems like, and I don't want to put words in your mouth, but it kind of seems
Yes.
like when we talk about, when you give the example of people saying, well, that's how it is, that there is a sense of fatigue in
Hmm.
not just the Black community, but in all marginalized communities, a sense of fatigue for constantly having to fight. And you're right, this is urgent. We need to breathe more life into the fight and keep on fighting. But how do you do that? Because when people look at things now, I don't think they look at it in the lens of history, right?
Hmm.
Life
Hmm.
is life is learned by looking at the past but living for the future. So
Yeah. Yeah.
people don't understand that in this present moment there's a whole history behind a fight, and
Yeah.
it's just a fatigue. Like how much can you fight? So how can we energize the fight for
Mhm.
those people that are just like, oh, this is how it is.
Yeah. No, no, no. I hear what you're saying, and that's a beautiful point. And that truly is the struggle, right? Because, especially if you look at it kind of through this justice lens, right? Because people are like, look, we've been trying to fight for justice, and it seems like when you make two steps forward, you're also making three steps back at the same
Mhm,
time, right?
mhm,
And I think what's really important, a really important notion or way of seeing this is looking at justice as kind of beyond this notion of just fair treatment, but to a notion of faithfulness to the demands of a relationship. A lot of times when we talk about hope, because a lot of people will say, oh, we just gotta have hope. We do have to hope for the future. We really do. But we can't see hope as an event, like it's just something that's going to happen, like
mhm,
and we can't see it as only connected to just merely our circumstances either, right? Hope has to be squarely centered in love, because what I love, I will always have the energy to fight for. Right? You know what I'm saying? Like, come on now. I'm Mama Bear. Don't
mhm,
come, don't come for Mama Bear babies.
mhm, mhm.
That talk about some energy
Yeah.
rising up. I'm as energized as you ever gonna see. I'm just saying, you know what I'm saying? And
Mhm,
so yeah, so kind of, really centering, right? The significance of the demands of a relationship. That's where justice has to be for us. And in the midst of that hope that we have, right? It's really and truly living into that love. And I really think, and this may sound a little crazy, but we need to fall in love with each other as
mm,
communities, as humans, right? Just being able to look into the face of another and truly, with all of the fallacies, the foibles, all of the, all of the imperfections, but truly being able to love. And I don't think we even talk about that kind of powerful love. I ain't talking about that romantic stuff that's
mm,
everywhere and all the songs are talking about. But I mean, that kind of love that, for me as a person of faith, that is mirrored in, this faithfulness, right, to one another, the faithfulness that divine mystery
mm.
blesses us with every day. My God, man, we walk outside, the sun is shining. Even on a rainy day, the sun is shining. You can't see it because of the clouds, but the
Right,
sun is shining. You know
right.
what I'm saying? We,
Mm,
we are literally, we are fed, right? By, we have vegetables, we have fruits, all of it, that is divine mystery. That is a loving creator, always, always loving and caring and giving and gifting us every day. So I'm saying, that us mirroring that kind of relationship to one another, right? And as a sister of mine, a sister here, Lydia Munoz, she was just doing a beautiful kind of word today, talking about how we need to be sanctuary for one another, right?
Mm,
Yeah,
mm,
showing up in the world as somebody saying, what does it even look like for me to be sanctuary for somebody in my community? You know what I'm saying? Like that kind of love that really makes us wake up and say, what do I owe to those around me? And what's owed me? Because a lot of times we may not really cognitively, think of it that way all the time of what is owed to me and what do I owe
right.
others.
Hmm.
But that's important. It's important to think about that, right? Because we really do have a moral responsibility to one another
Yeah.
to
Yeah.
care for each other. We have a hand in each other's health, right?
Hmm.
Yeah, and that's why, and I'm gonna tell you, that's why I wrote my book. That is exactly why I wrote my book, because and my book is not just for Black women, right? Black women is just the starting point. It's just a starting point. It's to contextualize the issue of health disparities and how that is also, combined with, spirituality and economic systems and healthcare systems. All of these things, work together. And so I contextualized it with, the experience of Black women.
Hmm.
But it's truly about, our story as Black women is so much intertwined and connected to your story, you know, and other folks' stories, whether they're African American, whether they're, Latino, whether they're Native American. Our stories are so very much connected. And I think that's one of the biggest lies that's being told to us, now, is that
Hmm.
we are so different from each other that, we don't have something in common. We have a whole lot in common. And you being a historian, you know that. You know
Yes.
how these threads come together. You
Hmm.
get it.
So let's talk about your book. And please, you've explained a little bit. Let's dive into it a little bit more. The crucial aspect of why it's not centered. Black women experiences are not the center part, but why centering is so crucial. And
Mhm.
what does this practice that you talk about in your book, what does it look like?
Yeah. So, it's so significant for me. The reason why
Before we get
yeah.
started, let's tell everybody the title of your book. we plug in your book. Go out there and buy the book. They need to know what the book is. So that's a
Yes.
failure on my part. The book is Womanist Bioethics.
Yes.
All right. All right. So,
Yes. Yes. That's right. Womanist bioethics, social justice, spirituality, and Black women's health.
mhm,
And the reason why I wrote it, is because in order for us to really get like this adequate understanding of what justice actually means in human relations, right? It requires that we start with the needs of those most vulnerable among us, and by listening to those who are vulnerable among us, we can get a fuller sense of what our concepts that we throw around every day, like neighbor love and respect and dignity, right? Child of God. We can get a real clear concept, clear, fuller sense of what those concepts mean. And so what I try to really demonstrate in this book is that to prioritize the perspectives of those who are vulnerable for the sake of the common good doesn't devalue the gifts of folk who consider themselves, not to be vulnerable, right?
mhm,
But it acknowledges the necessity of the gift of solidarity. And that's what's important, right? This realization of how we are absolutely connected. how our stories are connected, right? And in my book, actually, it does show that the lives of Black women actually testify to the current state of the healthcare system, right? And it doesn't just testify, but it also interpret and critiques it, right?
Mm-hmm.
Yeah, interpret and critiques it, and so that's why for me it was really important to include these different narratives, the stories. Yeah, it was very important to include these different stories so that people reading it could actually could get a sense of you know well, what's going on in the lives of people who are being underserved within our healthcare system. You know, folks who I say are on the underside, right? On
Mm-hmm.
the underside of our food systems, not just healthcare systems, but even our economic systems. So that's really really important, and I think that's one of the places where we really have to do a better job of really seeing how we are responsible for one another's health and well-being. Full stop.
So you're not speaking solely to equality here. You're speaking to equity, which are two different things. When you're talking about marginalized, that's the reason why, to me, it seemed like you made a very clear point. We're not saying one is more important than the other, but what we are saying is there are people who are underserved, that even if you did equal, it still wouldn't make up for the fact that they've been underserved for so long. So we're not solely talking about equality, we're talking
Right.
about equity.
That's right.
You emphasize a lot in your book about the role of Black church and
Mhm.
specifically for advocating for our health equity. That's the point, ladies and gentlemen. Equity.
Yes.
What unique strengths does the Black church bring to this fight?
Mhm. Yes. So I think a very important strength is definitely this legacy of care, right? Because the Black church was the Black church being really like the first real institution in the Black community, because it existed even during slavery,
Mhm.
but but it was the hush harbors, right? So it existed, kind of in secret, because it was, of course, against the law for us to gather and stuff. They were scared of slave revolts and all that. But so that Black church was always there doing that care work, kind of bringing folks together, caring for the souls of folk, but even the bodies as well. And so the real resource that these communities have is, first and foremost, they are right there on the ground, right? So I call them the first responders, because when it comes to issues take the issue of maternal mental health. So Black women suffer disproportionately from maternal mental health issues, and Black folks have talk about a disparity when it comes to access to mental health care services. Okay, so a lot of times they'll go to that pastor first, right?
Okay.
Who is
Um,
not equipped, who is not a therapist. And we gotta be clear about that. They need to refer. The pastor needs to refer.
I say that all the time. Your pastor can give you religious guidance, but if you need mental health, you got to go to a mental
Get
health
a
professional.
mental health care professional.
There are going to be some men that are going to be watching this that don't understand what maternal mental health is. Can you explain what that is? And can you explain why Black women experience it at a higher rate than other women?
Yeah, so oftentimes after a woman has given birth, and that kind of one within a 1 year period, a woman can go through something called postpartum depression.
Mhm.
And oh my goodness, this is real, where a woman can feel, because you see the beautiful images of mama with the baby, and you can tell that there's that loving connection. But depression can make a woman feel so much sorrow, so much, so they can struggle with even feeling a sense of connection to their own child,
Mm.
right? Um, and so these symptoms of depression will surface, and there some women, they don't even want to leave the house, right? They can't, because depression is real, right? So they
Mhm.
can't even bring themselves to care for themselves, let alone a child, right? And so to be able to really help a woman deal with that and get the help that she needs is extremely significant, because not just the woman is suffering, but that baby is going to be at risk as well. And so what was the second part of your question? Make sure
How
I
how
addressed what you were saying.
does the disparity of care
Yes, disparate in care.
lead to the
Mhm.
disparity between
Yes.
the maternal mental health?
Yes. So there is, it's really crazy, because given the lack of access, right? Because we have disparities in access to mental health care in general for African Americans, right?
Mhm.
That just exacerbates this problem of maternal mental health. And so another thing that is really problematic is, the stereotypes of Black women. So if you have a Black woman who, she might be going through a divorce or separating from her partner, and she has kids, well, she does not want to let it be known that she's suffering mental health issues, because there are stereotypes of Black women as bad mothers,
Mm.
out there. And there is research on this, I'm telling you. And so women, some of them will not go and get the professional help that they need,
Mm.
right? You see what I'm saying?
For fear
Um,
of being branded where you could possibly lose your kids? Is that kind of the
exactly.
connection? Yeah.
Of losing, yeah.
Yeah.
So it's just so, and it's just wild, like the kinds of complications, right, that end up happening. And then if there's not, a concordant care, because sometimes, a person can get a mental health care provider, but if that person doesn't have cultural humility, or they really don't understand, culturally, this person, the mental health care provider can actually sometimes even do harm, right? Because
Mm.
they're not understanding kind of these cultural things that are important, you know. So there are so many layers to this issue, right? So
Yeah.
many layers. Yeah. Yeah. And sometimes there is a mental health mental health care provider. We have partnered in writing an article together on maternal mental health and the church,
Mm.
because we really want to help churches to really help address the stigma that's associated with mental health within African American and even other minoritized communities, but also to help these churches to have the resources and take advantage of the resources in the community, so that people can be helped through these issues.
Yeah. Okay, Dr. Wilson, can you tell me about the Momnibus Act? First of all, did I say that right? And second of all, what is it?
And yes, you did.
All
Yes, you
right, thank
did.
you.
It is such a significant piece of legislation, right? The Momnibus Act is a set of bills that set aside, money investment that targets maternal mortality and disparities, right?
Mhm.
So, for example, there's funding for community organizations to improve maternal health for veterans, and for incarcerated mothers. Like, I mean, this set of bills is so powerful. And I'm going to tell you though, given the current, kind of policy environment that we are in with so many rollbacks, my concern is that bills like the Momnibus Act and the Pregnant Workers Fairness Act. Now, that's
Mm.
another one that we don't really talk about that much. And this act actually has to do with accommodations on a job to help a woman do her job, or a birthing person do their job, right? So if you have limitations due to pregnancy or childbirth related medical conditions, this act allows you to do, telework, you can work remotely, extra bathroom breaks and water breaks. And I know it sounds like, well, of course people should be able to have it. But we would be surprised at how many jobs for some women this does not exist. And that's why the fight for the Pregnancy Workers Fairness Act actually happened, right? Because women were really having problems trying to get, a lighter duty of work and the leave for childbirth beyond just the regular leave. But if a woman has these extended complications related to pregnancy, these kind of legislation, I tell you, very important. The Mama's First Act is another one, because that's where, we have an amendment to the Social Security Act to allow doulas and
Mm.
midwives to be reimbursed by Medicaid, right? So our policy environment is so important, and I really just hope that your listeners, folks will get out there, learn about these policies, and learn about them in your particular context, right? In your state, and to see if your state is able to still support this kind of legislation, because it's needed. We need it, and we don't quite know if it's being supported at this time.
Wow.
Yeah.
Wow.
Yeah.
So, Dr. Wilson, you talk about some serious stuff, some important stuff, but some stuff that people would deem as controversial. Not us, because they not like us. But not but you always get pushback when you talk about equality and equity for marginalized groups. What are some of the pushbacks that you've received from your work?
Yeah, yeah. It's interesting because I history is so important to me. And, with us being now in an environment where even history is politicized is is absolutely heartbreaking. It's so
Mhm.
heartbreaking because history provides us with the resources, the cognitive resources. When we know someone else's story, when we know another group's story, that gives us resources to have the kind of empathy that is needed, right? To come in to work in solidarity, to help us be sanctuary for one another. These kinds of things, that's what's so important. So for me, I really do lament the fact that we are now in an environment where history is seen, is something that is deemed to be dangerous if it's not in a certain package, right?
Right.
And that is where I just say, God help us all God
Mhm.
help us all. Yeah, because that is history is a powerful thing, and it's such a resource. It's such a resource that we need.
Yeah, yeah, yeah. Because like I said, you learn from the past and you live for the future. That's my slogan. I stole it from somebody. I don't remember which scholar I stole it from, but I stole it. That's not a Bruce original, y'all. But I'm rolling with him. Gonna get it tattooed on my chest.
I love it. That's great. That's great.
So we've talked about the disparities, acts
Mhm.
that can be done, and you made a point to say, people find out what's going on in your state. My
Mhm.
goal of doing this interview is to always open people's minds to stuff that they didn't even know or think about. Like I said at the top, historian, didn't dawn on me that, of course, hospitals would also be segregated. But then it comes to a point where you learn this information, and then it's, what are you going to do about it? So
Yes.
you said not too long ago, find out what's going on in your state. But how can people get
Yes.
involved and start pushing for the legislation that is needed so that healthcare is equitable across the board?
Right. Right. So definitely, I always talk about, awareness first and foremost, right? But collaboration,
Mm,
right? We really need to collaborate. We need to become aware of who's in our community and what they're doing, right? Because we have so many grassroots organizations that are actually working toward, birth equity, right?
mm,
So
mm,
that people can all birthing people can have access to the kind of care that is needed for not just prenatal care but the postpartum care, right?
yeah.
So there are these grassroots organizations within our communities that are doing the work. We have Black Mamas Matters Alliance. They are one of my favorites because they
Okay.
do these wonderful conferences every year. And even I like to go because I always learn something. Just like you said, we always learning something.
Always learning.
And
Yep.
so I am loving it because they are bringing together, they work according to my philosophy, right? Like I have a philosophy of, we need to bring together all the different sectors in our society, in our community. So you get folk from healthcare, you get the church, you get the academy, you get, everybody coming together and literally strategizing of how do we address these problems. And so one of the things I had a Black Maternal Health and Black Church Forum, and we came together with we had nurses, physicians, so we had gynecologists, we had public health professionals, we had midwives, doulas. I mean, we would try to get everybody at the table, the pastors, everybody. And when I tell you, when we came together and I told everybody, I was like, this is a strategy session
Mm,
because lives are hanging in the balance.
yeah.
So it's not time for like having a little conference, no, we need to come together, strategize about how do we collaborate, right? Because we're all doing, a part of caring, the care work that takes place in our communities. The doctors are doing it on their end, the midwives and the doulas are doing it on their end, the pastors doing it on their. But how do we come together and collaborate?
Mm,
Get to know, okay, just what are you doing now? And how can I help you do what you do and really try to address these needs? They call it this kind of this beautiful kind of caring for the whole person. How do we have this layered approach to care, you know, by working together and coming together and finding out what each other doing instead of it's because I know sometimes church folk might be a little reticent about the folk in the community, different organizations in the community, different organizations might be reticent when it comes to the church. Like, no, I don't know about them folk. But you know what? If we can come together and just find out, yeah, what do you actually do rather than
mm,
all of the ideas we have about one another, right?
mhm,
I have a colleague who talks about to actually engage others in a serious manner is to discover how often we are mistaken about them.
Yep.
Right?
Mhm.
Yeah. And so if we, because it's very easy to hold on to stereotypes and caricatures rather than really come together and try to say, okay, what do you do? And how do
Right.
you do what you do? And how can we line up, with what we each do to literally care for the community and people who really need help.
I love that. That is beautiful. Ladies and gentlemen, that is Dr. Wilson. Dr. Wilson, I want to thank you so much for coming on the show and talking about something that is extremely important, something that a lot of people just aren't aware of. Everybody talks about, we're going to have a baby, but they don't understand what goes along with it. And I think that they've learned that, hey, not just what happens to you, but also what happens to the other lady that's in the next delivery room, right?
Yes.
So I want to thank you so much for coming on the show. I know my audience definitely enjoyed this in-depth and deep conversation.
Thank you so much for having me. It's been an absolute pleasure and enjoy.
It was my pleasure as well. Thank you. As we wrap up this enlightening conversation, I want to extend my deepest gratitude to Dr. Wilson for sharing her profound insights and experiences with us today. We've journeyed through her remarkable career, exploring the intersection of bioethics, theology, and gender, dug into critical issues of health disparities and the legacy of care within the Black community. Dr. Wilson's work, particularly her book, The Womanist Bioethics, challenges us to rethink justice and equity, urging us to prioritize the needs of most vulnerable among us for the common good. Her passion for advocating for health equity and her dedication to uplift marginalized voices reminds us of the power of collaboration and community. As Dr. Wilson emphasized, it's not just about awareness, but about taking action, engaging with grassroots organizations, supporting critical legislation, and fostering solidarity across all sectors of society. I want to give a heartfelt thank you to Dr. Wilson for her invaluable contributions, for inspiring us to be the sanctuary for one another. To our audience, I hope this conversation has opened your minds and your hearts to pressing issues we face and the steps that we can take to create a more equitable future. Remember, the journey doesn't end here. Let's continue to learn, engage, and make a difference. I want to thank you for watching. I want to thank you for listening. And until next time, as always, I'll holla. Woo! That was a hell of a show. Thank you for rocking with us here on Unsolicited Perspectives with Bruce Anthony. Now, before you go, don't forget to follow, subscribe, like, comment, and share our podcast wherever you're listening or watching it to it. Pass it along to your friends. If you enjoy it, that means the people that you rock will enjoy it also. So share the wealth, share the knowledge, share the noise. And for all those people that say, well, I don't have a YouTube. If you have a Gmail account, you have a YouTube, subscribe to our YouTube channel where you can actually watch our video podcast and YouTube exclusive content. But the real party is on our Patreon page, After Hours Uncensored and Talking Straight-ish. After Hours Uncensored is another show with my sister. And once again, the key word there is uncensored. Those are exclusively on our Patreon page. Jump onto our website at unsolicitedperspective.com for all things us. That's where you can get all of our audio, video, our blogs, and even buy our merch. And if you really feel generous and want to help us out, you can donate on our donations page. Donations go strictly to improving our software and hardware so we can keep giving you guys good content that you can clearly listen to and that you can clearly see. So any donation would be appreciative. Most importantly, I want to say thank you, thank you, thank you for listening and watching and supporting us. And I'll catch you next time. Audi 5000. Peace.